record. All right. Welcome, Zoe. Thanks so much.
Thanks, Christina. Hi, everyone. I'm Zoe, as Christina mentioned, and I work at a private practice clinic called Oncore Nutrition. Like Christina said, this is a Q&A, so Christina's kindly sent through lots of questions that you guys have had, and I will work my way through the questions. Any other questions that come up in the meantime, feel free to pop it in the chat, and I'll try my best to get to it. Um, I'm happy to just start from the first question that was sent through, if everyone's okay with that.
Yep.
Yeah. So one of the first questions that got sent through was, what supplements would you recommend taking for general well-being? I'm not sure who sent what question, so I'll just go with the first one that's been sent through. And I think this is a really great question. The first and most important piece of advice that I would give before taking any supplements is you should always get a nutritional assessment, which is the first step, and a blood test. And this is so that we can really understand your specific needs. A blood test will give us that clear picture of your nutritional status. So we'd check key nutritional markers like iron, glucose metabolism, vitamin D, and a full blood count, as well as cholesterol. And this is important because taking supplements that you don't need can be a waste of money, firstly, if you don't need them. And in some cases, certain supplements can actually be harmful or interfere with your medications that you're on if you're taking chemo, radio, or immunotherapy. So we want to make sure that there's no interaction. And usually we can get everything we need from a general well-being from a well-balanced diet. So that's by including things like whole grains, dietary fiber, antioxidants, dairy, calcium, non-starchy vegetables, and legumes. If something came back from that blood test that was out of range or out of that reference range, as we call it, we could then supplement to get you to that target within that target range. So if your vitamin D was low, we might supplement that. It's often the most easy and correct way to get it back within that range. If your iron was low, we might recommend a supplement along with a dietary strategy or a dietary plan. I think it's really important to check in with your medical team. Here at Oncore also provide a free 15-minute chat. So you're welcome to be in contact with us, and I'll pop our details up at the end of this of how you can get in contact. Because even vitamin C or some grapes, they can interact with breast cancer treatment. So it's little things that you might not think about that we just want to make sure that we're giving you the best outcome that you can get from the treatment. That's the answer to that question, which was, what supplements would you recommend taking for general well-being? The next question that came through was how to manage hypocholesterolemia brought about by anti-hormone therapy. That was one question. Another one that was really similar was, am I getting enough calcium and vitamin D in my diet? How do I do this without it affecting cholesterol secondary to anti-hormone therapy? So the first thing is that sometimes the hypocholesterolemia might be medically caused, which means that it might need to be medically managed. However, from a dietary perspective, there are definitely certain things that you can do to manage your cholesterol profile. So what I would focus on is fiber, particularly something that we call soluble fiber. So soluble fiber acts like a sponge in our digestive tract. So it binds the cholesterol and removes it from the body. So sources of soluble fiber can be things like oats, barley, seeds, so like chia seeds or flax seeds, legumes, apples, carrots. A really good way to think about soluble fiber was that if you had a pot of water, boiling hot water, what could you throw in there that would absorb water? So oats would, chia seeds would, apples would become soft, carrots would become soft. So that's a really good way to think about, is it a soluble fiber? Whereas if you were to put celery into that pot, we know that that wouldn't absorb the water. So that's what we call an insoluble fiber. Really easy ways to include soluble fiber in the diet are things like having a bowl of oats for breakfast and putting some chia seeds in it, or adding a handful of beans to a salad or a stew or a curry, or snacking on apples or carrots. We also want you to prioritize healthy fats when we think about hypocholesterolemia. So that's a high cholesterol level. So not all fats are created equally. We want to focus on unsaturated fats and limit saturated and trans fats. So I always like to think about what can we swap or what can we add rather than what can we cut out. So this would be things like avocado, nuts, so almonds and walnuts, seeds, chia seeds, like I mentioned before, and flax seeds, and using lots of extra virgin olive oil. And there's another type of fat that we call an omega-3 fatty acid. So that's what you can get from fish. So salmons, sardines, tuna, and they're particularly beneficial for heart health. I would also advise to limit red meat to no more than 500 grams a week and limit things like butter, coconut oil, and processed foods because that's what falls into that saturated fat category or trans fat. Overall, I'd recommend a diet that's rich in fruits, vegetables, whole grains, and legumes. And that's what is known as a Mediterranean style diet. And you may have heard of that before, but that's a really great model to follow. Plant sterols and stanols. So these are compounds that are found in plants that can help block that absorption of cholesterol. And I think the next part of the question was getting in vitamin D and calcium into the diet without compromising cholesterol. So we want to focus on calcium-rich foods. So that's full cream milk or plant alternatives. Plant-based calcium sources. So these are all naturally cholesterol-free. Dark leafy greens. So kale, collard greens, bok choy, legumes. So beans, chickpeas, edamame, lentils, they all contain calcium. And also fish with edible bones. So canned sardines and salmon with bones are both a great source of calcium, and omega-3s, which are, like I mentioned a little bit earlier, are really beneficial for heart health. Vitamin D sources that are cholesterol friendly, so are not going to spike your cholesterol levels, is getting out in the sun, which if you're in Melbourne, that can be quite hard at the moment. So whenever there is sun, we say to try and expose a quarter of your body for 6 minutes if you have fair skin, or 15 minutes if you've got darker skin. And it can just be putting your arms out or your legs out or just your back, just some part of your body to expose is a really great way to get vitamin D in. Dietary sources of vitamin D is fatty fish, fish oils, beef liver, fortified milks. They're sometimes fortified with vitamin D. Cereals as well can be fortified with vitamin D, and eggs. It's really interesting, but if you get mushrooms and put them out in the sun, they actually absorb vitamin D. They become fortified with vitamin D. In the summertime, you can buy fortified vitamin D. Oh, sorry about that. I don't know what happened there. Can you still hear me okay?
Yep.
Ah, perfect. In the summertime, you can buy the fortified vitamin D. Otherwise, supplements. So if you struggle with getting enough vitamin D from what I've mentioned, you might, especially with anti-hormone therapy, many doctors might recommend starting to take a vitamin D supplement. And that's often a really reliable way to ensure adequate intake without having to worry about cholesterol. One of the other questions that was asked was, are there any foods we should definitely avoid during our breast cancer journey? And I think I'd like to say, what can we eat less of rather than what to never eat or to avoid? So it's really good with alcohol, we want to focus on limiting the alcohol intake. So the studies and evidence have shown that 6 grams a day, which is about half a glass of wine, is enough and more than enough. We wouldn't want any more than that. We want to swap, like we discussed in that previous question, the saturated and trans fats for the mono and polyunsaturated, which are things like avocado and nuts. So the healthy fats, cooking with extra virgin olive oil, nut butters over butter or margarine, and reducing those processed foods and takeaway foods. We want to reduce the red meat. Studies have found that swapping this for poultry, so that can be chicken or turkey or seafood, can be a really protective measure. Avoiding charring food, avoiding supplements or high doses of resveratrol, which is a phenol that acts like an antioxidant. So peanuts, grapes, and red wine, we say to eat in moderation because they can become quite high in that phenol. We want to avoid soy supplements because that can be associated with an increased risk, but we want you to enjoy soy-based food because they're actually a protective measure, which there is a question about soy. So I'm going to get into a little bit more detail about that a bit later on. The one thing that I would recommend that you don't take is collagen. So collagen, this recent studies have shown that high collagen levels may promote metastasis in breast cancer models.
Can I
Any other
ask where
questions?
you would find that? Is that like bone broth?
Yep, bone broth. You can actually buy collagen powder. So I think it's having the powder in your yogurt or food throughout the day is what we would not recommend. If you wanted to have a bone broth, that's okay. It's actually physically having the powder is what we wouldn't recommend. Because that's when that gets to the higher collagen levels, because there's collagen naturally in foods and that's okay to have, but anything other than that, we would recommend to avoid. One of the other questions was, there are certain foods to avoid while having chemotherapy due to compromised immune system, foods such as deli meats, raw fish, and unwashed salads. As soon as you stop chemotherapy, can you eat them again? I think this is a really great question. During chemotherapy, as most of you probably are aware of, is that your immune system can be weakened. And this is often because the treatment lowers your white blood cell count, so making you more susceptible to those foodborne illnesses from bacteria, viruses, or parasites. And that's why we recommend being extra cautious and avoid foods that are more likely to harbor these germs. So that's those deli meats and raw foods. The immune system doesn't immediately bounce back to full strength the day after your last chemo dose. So the white cell count needs time to recover. And this timeline can vary for everyone, but it's typically within a few weeks to a couple of months. So if you're having port chemo, they say usually 7 to 14 days is when your white cell count will bounce back. Many people now get a GCSF or a PEG filgrastim, which assists count and recovery and prevents neutropenia, which is the low white cell count. So it's really good to check in with your chemo team when neutropenia is predicted for you and if it is at all. We actually have a food safety guide here at Oncore Nutrition. And at the end of this session, I'm going to give you guys a code that you'll have access through our website to get links to a lot of our resources. And like I mentioned earlier, we do have that free 15-minute call if you wanted to explore it more in depth and you were feeling worried about it. The next question was, I'm concerned that eating eggs and chicken might influence hormone levels as my breast cancer is hormone receptor positive. Could including these animal proteins in my diet have any effect on estrogen or other hormone levels? And I think we could talk about this for a long time, but the short answer is no. So including eggs and chicken in your diet will not negatively influence your hormone levels or impact hormone receptor positive breast cancer. The concern often comes from that idea that hormones are used in animal agriculture. So the truth is, in places like Australia and many other countries, it's actually illegal to give hormones to chickens. So the chickens that you buy at the supermarket are not treated with hormones. So even if they were, your body's digestive system is incredibly efficient and it breaks down the proteins and any other compounds from food you eat into what we call basic building blocks. So your body doesn't absorb animal hormones whole and then use them to create more of its own estrogen. So both eggs and lean chicken, so chicken breast, are really great sources of protein, which is so important for your body to repair tissue, maintain muscle mass, and support your immune system, especially during and after treatment. So I would say no need to be fearful about including that in your diet, and it plays such an important role. The next question was, does gut health play a role in overall well-being for someone with breast cancer? And what are the most effective ways to support a healthy gut? Yes, gut health plays a very important role in overall well-being, especially for someone with a history of breast cancer. And the gut microbiome, there's a lot about it, so I'm just going to break it down really simply, is that it influences your health in a few ways. So number one is hormone balance. So it helps your body metabolize and eliminate excess estrogen, which is a concern for hormone receptive positive breast cancer. Your immune system is the other one. So it's essential for strong immune system, which is really important during treatment and for recovery. And side effects. So a healthy gut can help manage common side effects that I see in my practice, whether it's diarrhea or constipation or that nauseating, unsettling feeling in your gut. The most common way to support a healthy gut is through a consistent whole food diet, like I mentioned before, that Mediterranean style diet. And that's by eating a diverse range of foods that are high fiber. High fiber is the most important food for your gut bacteria. It focuses on whole grains, legumes, nuts, seeds, and fruits. And that's also really important when we think about the cholesterol, like we mentioned a little bit earlier, with binding away from the cholesterol. Including fermented foods, so foods like plain yogurt, kefir, sauerkraut, kimchi, they contain really beneficial bacteria that can add to your gut diversity. And the last one is staying hydrated. So making sure that you're drinking lots of water for a healthy digestive system. A really important note is that probiotic supplements, whilst they are beneficial, they should be avoided if you're neutropenic. And this may have been discussed with your treating team, because when you're neutropenic, meaning you have low white cell count due to your weakened immune system, your body can't differentiate between a good and a bad bacteria. So it's best to either speak with us or your oncology team on finding out when in your chemo cycles you might be neutropenic, if at all. And then we can make sure that you're extra cautious around taking a probiotic if you were wanting to take one. The next question is, how can I maintain a healthy weight during treatment, especially if I'm on hormone therapy and on long-term medication? That was one question. And there was another question that was really similar. And it was, I've gained a lot of weight, around 30 kilos since diagnosis and treatment. Chemo, radio, Herceptin, tamoxifen, Femora, and finally Armadex for 10 years. Losing the weight is an uphill battle, but it is coming off very slowly, a kilo per month. By following a calorie deficit diet, walking, and some strength training, with so much information around about different foods, diets, protein, and fiber, it's very confusing at times. Is there any particular diet you recommend for weight loss? Also, how much protein per day should I be eating? Should I be eating and drinking low-fat dairy products? And I think there's lots to unpack here, so I'm going to break it down a little bit. And I think it's a really important question, and it's completely understandable to be concerned about maintaining a healthy weight, especially when you're dealing with the challenges of that hormone therapy and long-term medication, which we know can alter body composition. And these treatments can make weight management feel much harder, and it's really common amongst a lot of my clients who are going through that they feel that way. My approach isn't about giving you, a rigid or a strict restrictive diet. Instead, it's about making these small, sustainable changes that help you feel better and more in control. So I know that we don't have a lot of time, so I'm just going to explore the few things that I think are really important. And the first one being understanding the carbohydrates that you eat. So carbohydrates are really important, and they're not the enemy. And I think they get a really bad rap online. They are actually so essential for your body to function properly. Your brain and red blood cells rely really heavily on carbohydrates for energy. So if you restrict them too much, you might end up feeling low in energy, tired, and even more hungry, which can then lead to those intense cravings later on and what we call that diet cycle, which then leads to weight gain. Instead of focusing on eating less, we want you to focus on eating more of the right kind of carbohydrates. So what I mean by the right kind of carbohydrates is what we call a low glycemic carbohydrate, or a low GI. So these are foods like oats, rice, whole grain bread or wholemeal bread, sweet potatoes. And the reason that these are so important is that they release energy really slowly in the body. So it stabilizes your blood sugar levels. So what we call it's like the spike, and then it stabilizes across for a few hours. And that keeps you feeling full for longer, around 2 to 3 hours, and then you're ready to have your next meal. And that prevents those big energy crashes that maybe you might have experienced when you've eaten what we call a high GI food. And that's lollies, chocolates, biscuits, more of the processed foods, because when you eat them, you feel really good and you get that burst of energy. And then an hour or so later, you might have felt this before, you get that crash. And some people describe it as they could go have a nap, and those changes in their mood swings. So we really want you to be mindful about including a low glycemic index carbohydrate at every meal. Again, fiber-rich foods, really, really important from that healthy gut perspective, feeling satisfied after meals, from a cholesterol perspective, as I've touched on many times. Another really important point is non-starchy vegetables. So these are the powerhouses for vitamins, minerals, and antioxidants. So I would recommend that you fill at least half of your plate with non-starchy vegetables. So that's leafy greens, broccoli, peppers, get lots of nutrients without a lot of calories. So that's a really good way to like bulk up your meal, is what we call it. And the final one is including a quality source of protein. So that's a lean protein. So that can be chicken, fish, eggs, legumes, and this helps you feel full and supports your muscle health. So it's what we call it preserves your lean muscle mass, which is a really important way if you're looking at weight loss. And I guess there is so much information out there and it's so easy to get confused. So instead of a fad diet, the eating pattern I recommend is that Mediterranean style diet. It's not restrictive, but it's a model for healthy eating. And it emphasizes all of these foods that we've discussed: whole grains, fruits, vegetables, legumes, healthy fats, olive oil, avocado. And this style of eating is really well supported by the evidence for its benefit in heart health, weight management, and overall well-being. For the lovely lady who asked the question about strength and how much how much protein to have, I think it's really great that you're engaging in strength training. I think it's so important for preserving and building your lean muscle mass. A general recommendation would be about 1 to 2 to 1.5 grams of protein per kilogram of body weight. So for example, if you were 80 kilos, that would be around 96 to 120 grams per day of protein. And it might sound like a lot, but it can be achieved by including sources of protein at every meal and snack. And if you were wanting to know more about this, we can jump on a call or you can email me and we can go into more depth about it. But that's just a rough guideline, and everyone is really different depending on what training you're doing, if any at all, and what your diet looks like. The next thing is that I know it can be really hard, but we want to try and sometimes think beyond the scales. So focusing on a number can be incredibly frustrating, especially through hormone therapy. And the medication itself can cause these changes in body composition that are really difficult to control. So what I would recommend is focusing on building that lean body mass through consistent, safe, and enjoyable movement. The studies have shown that if you do strength training or high intensity training before chemotherapy, it actually improves the efficacy and the output that you're getting from the chemo. So if you're up to training before a session, it's very much recommended. I would really recommend talking to an exercise physiologist or physiotherapy who specializes in oncology, because they can help you find an exercise routine that's tailored to your specific needs, considering any past surgeries or any other limitations that you might have. As well as if you're worried about your diet, you can link in with a dietitian too. So they go really well hand in hand. I think regarding dairy, the choice between low fat and full fat is often a personal one, but a guide would be, it's really tricky because the evidence is shifting in the world about dairy and breast cancer. Low fat dairy products are a great option for managing calorie intake, especially when you're aiming for a calorie deficit, which is where there's the weight loss. They provide the same amount of calcium and protein as the full fat options, but with fewer calories. It's really important though to be mindful about label reading, because sometimes when it's low fat, it doesn't mean that it's low GI or low sugar. So we really want you to check the labels before just jumping for that low fat dairy option, because the full fat may be a better option from when we look at all of the full nutritional label. Again, that can be things like Greek yogurt, ricotta, are really great options because we know that they're low sugar, low GI. They're not necessarily low fat, but you're getting the benefits from it. And the other thing is bone health. So on hormone therapy, getting enough calcium and vitamin D, like I mentioned earlier, is really, really important. And the great news is that you can get the same amount of these nutrients from low fat options like skim milk or low fat Greek yogurt, just being mindful about the nutritional label and making the right choices. Like I mentioned earlier, you can sit out in the sun, you can buy fortified vitamin D and calcium foods. I think the final thing is that we want to look at the big picture. So diet and exercise are just two pieces of the puzzle. We'll also need to consider your overall well-being, which is the most important thing. So what's your relationship like with food? The journey through cancer treatment can change how you feel about your body and your relationship with food. And if you're wanting to support that a little bit more, we could definitely work on that together to build that positive, healthy behaviors that you feel are really supportive and good for your overall well-being without focusing on feelings of deprivation or shame in your body. The circadian rhythm. So there are some interesting evidence about the benefits of eating in sync with your body's natural rhythm. So that is what we call intermittent fasting, of eating, mindfully during windows as a sense of control for you and structure without, imposing rigid food rules. Um, and you can also work, well, I can also work if you want to see a dietitian with your oncologist. So understanding how your specific medication might be affecting you. And we might look at things like your cholesterol profile or your insulin levels as more meaningful ways to track progress than just that number on the scale. I hope that answered that question because, like I said, there was a lot to unpack. Feel free to write anything else in the chat and we can get to that. The next question was, what diet meal plan helps with fatigue and significant muscle and joint aches? Diet to support one's strength. I'm wanting to learn more about nutrition from the perspective of increasing energy levels. Again, the Mediterranean diet is what I'm going to keep coming back to. But I think a well-balanced diet can be a powerful tool for increasing energy, reducing inflammation, which often is a contributor to those aches and joint pain, and supporting your strength. So the goal is to provide your body with consistent fuel and nutrients that fight that inflammation. So the first thing is lean protein, like we've spoken a lot about, whether it's lean meats, chicken, fish, eggs, dairy products, Greek yogurt, plant-based options, beans, lentils, tofu, nuts, all really great lean protein sources. We want you to embrace those healthy fats, omega-3s, heart health fats that we've spoken a lot about because they can reduce inflammation and directly help with the joint and muscle aches. We want you to choose those low glycemic carbohydrates because they provide your body with that sustained energy throughout the day. We want you to maximize your micronutrients. So that's a variety of colorful fruits and vegetables by filling up half your plate with that. Try eat the rainbow at every meal if possible. Another really important one is anti-inflammatory herbs and spices. So fresh ginger, we say to aim for at least a teaspoon a day. You can add it into tea, stir fries, smoothies, soups, depending on the time of year. Turmeric and black pepper, so curcumin, which is what's in turmeric, is actually best absorbed with black pepper. So if you were wanting to have turmeric in your diet, you can have that with a pinch of black pepper. So that can be in curries, scrambled eggs, smoothies. It's got a quite strong taste. So sometimes people prefer to take it in a supplement form, which you can buy with black pepper in it as well. Green tea, it's a really soothing swap from coffee and it's rich in polyphenols, which is antioxidant. And cinnamon is a really great spice to add to your breakfast bowls, smoothies, or yogurt. It supports your blood sugar levels and it's antioxidant rich. And that's going to help with your joint pain. The next question is triple positive stage 3/level 3, 53 years old when diagnosed and consequently went into menopause. I hear and read conflicting evidence about soy products in relation to it being a contributing factor to breast cancer. Could you please clarify? This is a great question, and I know I touched on it really briefly a little bit earlier. Based on the most current and comprehensive evidence, the guidance that I would recommend from a soy perspective is that whole soy foods are safe and potentially beneficial. So you can confidently add 1 to 2 servings of whole soy foods in your diet. So that could be soy milk, tofu, edamame. These foods are a really good source of protein and fiber and can be a really healthy part of your diet. So definitely yes to including whole soy foods. However, I would advise that you avoid high dose soy supplements. There's conflicting data and potential harm, so it's best to avoid concentrated soy or isoflavonoid supplements. So yes to the whole food, no to the supplements. The other question is, I was diagnosed as celiac, lactose intolerant, and fructose intolerant at 31. I was diagnosed at 32 with DCIS in the right side. Are there any foods that I should avoid or any that I should incorporate into my diet to help prevent developing breast cancer in the left side or any other cancers? And I think I've probably gone through what's best to include and what's best to just be mindful of. There is a World Cancer Research Fund with nutritional recommendations on breast cancer. I'm going to share my screen with you guys to show you what it looks like, because if there were any concerns about specific things in your diet that maybe I haven't touched on, this is a really, really great document to read through. In summary, it talks a lot about doing physical activity, reducing alcohol intake, lowering body fat, including starchy vegetables, dairy products, are really great for decreased risk. But like I said, if you wanted a really in-depth response, I'll share my screen with you guys and show you what it looks like. Can you all see that? Yep. This is a really great document to read through. You can take a photo or write it down. There are quite a lot of pages, so only read through what's necessary, but it's something that I use a lot in my practice to guide me through the evidence that is out there. Everyone okay with that one? I'll stop sharing my screen. Yep, perfect. The last question is, what diet would you recommend for us dealing with menopause symptoms such as insomnia, mood swings, tiredness? I've tried so many herbal supplements for insomnia without a great success. I'm currently taking magnesium powder at night and take sleeping pills every couple of days as I work full time and need to function. What else can I do? And I think that this is really challenging. We have a menopause guide that actually guides you through step by step of what we would include. I'm going to share my screen with you in a moment of how you can access these really helpful evidence-based guidelines that we've made. That there's one on menopause, and we've actually got our own podcast called Two Peas in a Pod. And that is that we've got a whole specific podcast to sleep and nutrition. So I would really recommend giving that a listen. We also have a few other series in the podcast about breast cancer and nutrition, and any other concerning questions that you might have are probably most likely answered in that podcast. I am going to share my screen with you guys just to show you how you can get access to. Give me one moment. Can you see that? Yeah. So if you're interested in learning more about the evidence-based nutrition and lifestyle strategies for recovery and long-term health, I would really encourage you to explore our Oncore Nutrition guides. I know that there's been a lot of information that we have gone through in this session from all of your great questions, but I think we've put together a few handy resources that we use amongst our patients at Oncore Nutrition, as well as interested healthcare professionals. So please feel free to download this from our website, store.oncorenutrition.com, and you can use a free code that we've provided to you called Think Pink. So there's breast cancer one, there's a Pink Think one, there's a low glycemic index one, there's the menopause one. So there's lots of different guides that we've created that you are more than welcome to get access to. Going on from that, I think we also offer, like I mentioned a few times, a free 15-minute consult if you wanted to understand a little bit more of what it's like to work with a dietitian and that tailored advice that we can give to you. You can book through giving us a call or that email on the screen, or you can book through online. We also have many ways that you can get in contact with us. So through socials, Instagram, Facebook. We have our own newsletter that comes out every week. We work telehealth and face-to-face. Like I mentioned, our podcast as well. So the Two Peas in a Pod. If you wanted to get a little bit more of information around breast cancer and nutrition, there are a few podcasts that go into a lot of depth with that. I think there's a question in the chat. Great. So there was a question that says, what about supplements for osteopenia? I think that's a really good question. So with osteopenia, there are a few supplements out there. The one that I would most likely recommend is a vitamin D plus K2 supplement. I'm not sure if you guys have heard of that before. And it is definitely important to run it by your oncology team before starting anything, like I mentioned at the start, just to make sure that if you are on any other medication, there aren't any interactions. But the vitamin D plus K2 is going to help with the absorption of dairy and calcium better for your bones. So the K2 boosts that absorption. You can buy it at the chemist. It's really easy to find, but that's going to help support your bone health a little bit more.
We might just open up the floor now. So if anyone has any questions, feel free to come off mute and ask your personalized question.
I just have a comment, really. That was really great. Thank you. I feel very validated. I generally eat a Mediterranean style diet, but I do eat, my biscuits and cakes and things on top of it.
Who doesn't, right?
So I think I'm doing all right.
Definitely. And I think that's a really important comment to make. Like, it's an 80-20, what we call it. Like, if you're not eating chocolate and cake, you're not living, because they're so good and so delicious that if majority of your diet is focusing on that Mediterranean style, then that's the best that you can do. Because there's so much joy that comes from, social events where there's cake or chips or chocolate, or even just wanting to have it as comfort after a long day. So I think that there's nothing wrong with doing that at all. Yes, Pauline, I can see that you've got your hand raised.
Oh, first of all, thank you very much. Sorry, this has been very useful. I've been rapidly taking notes with it myself.
I wasn't talking too fast.
No. And I'm glad to hear it's being recorded so I can go back and check things.
Definitely.
A question on the alcohol.
Yeah.
And particularly with the red wine.
Yep.
Where does rosé fit? Does that have less of whatever's not so good in the red wine, or is it, the same?
It's all the same, to be completely honest. The red wine is actually part of a Mediterranean style diet. But when we think about alcohol, it all falls into the same category. So if you can limit it to no more than 6 grams a day, that's a really good starting point. Trying to limit it as much as you can, just because of that small evidence that has been out there that it might be an inhibiting factor.
And what is it again that's in the red wine and the grapes and the peanuts you have to avoid?
Yeah, it is a phenol that can actually interact with the chemotherapy that you're doing. So that's why they say to just be mindful about the amount that you have, because that can then impact, if you're going through any treatment, of how effective it can be.
Okay, thank you.
No problem.
And if you weren't on any active treatment, Zoe?
Or for chemotherapy, like you weren't doing chemotherapy?
Yeah.
Completely fine to have in moderation. I think I always advocate to follow that Mediterranean style diet just because it's the best way of living. Red wine is part of the Mediterranean diet. So if you wanted to have that in moderation, it's okay. If you prefer rosé, a glass here or there is completely fine. I would just be mindful about the amount that you were having.
Ilona looks like she's having a very nutritious lunch.
Oh, I can't see so well.
She's got broccoli.
Maybe you were cooking as I was talking.
Yeah.
Throwing everything together.
We've just got, Rowena said, white rice, brown or wild.
Great question. I would say basmati rice. So basmati rice is the low in GI. You can actually buy low GI rice, but basmati is low GI. And again, like I mentioned, that you can get access to our free guides. We have a low glycemic index shopping, what we call like a shopping list. So it compares low GI to high GI. So it's a really straightforward, easy thing to read through of what rice should I have? What pasta should I have? I would advise basmati.
Sorry, Zoe, I can't find my hand up symbol on my
Ah,
phone.
that's okay.
Excuse the interruption. I do have a quick question, if that's okay.
Definitely. Yeah, go for it.
So I was told by my oncologist that some of the turmeric or curcumin was going
Mhm.
to impact on the medication I was taking, which is
Yeah.
just the tamoxifen.
Yeah.
Is that still the case?
Yes, if they've told you that that's the case, then definitely follow their guidelines. It's not for every medication though. So that's why it's really important before taking any supplements or antioxidants or anything like that. It's always run by your either dietitian or your oncology team, just to make sure
So
that you,
is
yeah.
there a substitute for the curcumin or the turmeric that I can use instead?
I would just say to have ginger, cinnamon, green tea, because they're all also got those anti-inflammatory benefits that we've mentioned.
Okay,
Um,
thank you.
Yeah, no problem. Once you've stopped was it tamoxifen you said?
Yeah.
Yeah, I would definitely ask if you can start taking a turmeric supplement if you wanted that extra support.
Yep.
But for
Not so
now,
much the supplement. I guess I'm looking at some of the actual vegetable or roots itself.
yeah,
Sometimes we
so the
use it in our
powder.
cooking. Just the fresh fruit.
Yeah, I would say to stay clear of it for now, as advised by your medical team, but
Mhm.
not forever, and
Okay,
just use some other things that we've discussed.
thank you.
Yeah, no problem.
Any other
Anyone else have
questions?
any? Yeah.
Yep, go
Yes.
for it, Pauline.
Oh, just regarding the ginger, I understand
Yeah.
fresh, is pretty well best all the time. But is there
Yeah.
is there any nutrient value in like ginger powder?
Yeah, the ginger powder is okay. The fresh, like you said, is the best source because it's from the roots and it's natural. But ginger powder, if that's well tolerated, ginger tea, any form of ginger is okay. It's got those anti-inflammatory benefits.
Oh, good to hear. Thank you.
Yeah, no problem.
Any other questions? Feel free to ask anything, even if you think it's,
There's no silly question.
yeah. But dairy milk is upsetting my system, so have been using soy. Should I have 2 cups daily? I do have osteoporosis.
Who asked that question? Caroline. Good question. It would probably involve a little bit more detailed understanding of what else is going on for you. With osteoporosis, we'd say to try and get about 4 to 5 servings of dairy a day. So if soy milk sits better for you, we know that that's fortified with calcium, so that's a great option. But we would want you to try and get more calcium throughout the day. So 2 cups is a great start, but we'd want you to try and get at least 2 or 3 more servings throughout the day. So that can be 2 slices of cheese or a cup of yogurt, a cup of milk. Does that answer your question? So just upping it up, just bumping it up a little bit. And if you were worried, again, you could take that supplement of, how we spoke about the vitamin D and the K2 combined as well, just to support you that little bit more.
I got a question for you, Zoe.
Yeah.
So I guess for our women with low energy or kind of busy schedules when you're having treatment, do you have any sort of advice for quick or budget-friendly meal ideas?
Yeah, great question. At the supermarket, there are pre-made meals, but I also know that people aren't always a fan of those. There is a lady that's called Wholesome by Sarah, and she has packs at the supermarket. I'll look it up for you guys and share my screen with you because it's super easy, a really easy way, quick, nutritious meal to have for lunch or dinner if you're on the go. You can get them at Woolworths. And the great thing about them is that they've got veggies in it as well. So you actually don't have to even worry about doing anything other than adding a source of protein. I'm just going to share my screen. Can you guys see this?
Yes.
Cool. So this is her range. It's called Simply Wholesome Pantry. And there are a few different, there's bulgur and quinoa. There is just a quinoa bowl on its own. And what I love about it is it's made with extra virgin olive oil, vegetables. And then all that I would advise you to do is add a source of protein to that. So it could be a tin of tuna, some cooked chicken breast, some eggs. And all you have to do is cook it in the microwave for 45 seconds. So it's a really convenient, quick on-the-go meal. If you were thinking about breakfast, I would suggest maybe making like an overnight oats, a chia pudding, a yogurt bowl. You can all make that all the night before. So it doesn't, you're not standing in the kitchen for hours, just throwing a few things in the bowl and take with you on the go, ready to have. But yeah, I love this product because, like I said, it's got the veggies in it. It's got the low glycemic carbohydrate that we spoke about, which is going to give you that sustained energy. And then adding in that protein source is going to preserve your lean muscle mass.
Thanks, Zoe. And Marianne just said, I love tray bakes or one-pot meals for easy home-cooked options.
Exactly. Slow cooked meals are so easy. You can just throw everything in the pot and leave it for the day. Tray bakes are great. Just throwing everything together. It doesn't have to be super complex. It can just be a few things in the oven and that's all. Yeah, like what I showed you is just a more convenient option to have in the pantry, just on a day where you don't have the energy to do anything and it's just popping it in the microwave.
I just have a question. I've been buying those bags of like stir-fry vegetables just so the kids, it's easy for the kids to make a noodle snack or something.
Yeah.
Are they okay, or are all the nutrients sort of out of them by the time they
they're completely fine. Completely fine to have. And same as frozen vegetables, if that's more convenient for you, they're fine.
Sure.
The only thing that I would say is that if you're buying the packeted ones, I'd make sure it's cooked really well, because if you are neutropenic, so the low white cell count, we want to make sure that you're not at risk of getting an infection or anything. So just cooking it quite well in the pan or in the oven, nothing wrong with them though. Same as the frozen.
Oh, great.
Fine.
And did you say Greek yogurt is okay, or natural
really
processed?
Good.
Oh,
Greek
okay.
yogurt.
Because I've noticed they put a lot of cream in it.
So what the brand that I recommend is Chobani. I'm happy to show you which yogurt I'd recommend. It's a low-fat Greek yogurt. I will share my screen with you, and it's naturally high in protein, which is really great.
Okay, thank you.
No problem. I'll share with you the one that I would recommend. This one. And I think it might be good to show you from a nutritional label perspective what to look out for, just so you guys are aware if you're ever looking at other yogurts on the market. So if we zoom into the nutritional label, I like looking at this one per 100 grams, just because it's a big tub. So the tub is 907 grams. So if it was just a little serving, we could look at that. But per 100 grams, we can see that it's got 9.3 grams of protein, which is a decent amount. Anything 10 or more is a really good serving. So if you were to go for that 160 grams, which is what it says here as a serving size, you'd be getting 14.9 grams of protein, which is really great. And that's natural, no additives. The fat total is 0.2 grams. So no fat, really, minimal. And sugars is 3.3, which is really good for a yogurt because a lactose is a sugar. So it's always going to be a little bit higher. But when we see that it's 3.3 and it's the light version, low in fat, high in protein, and low in sugar. So it's a really great way at stabilizing blood sugar levels, weight management, and, getting your calcium intake as well if dairy was a concern for you in bone health.
Just touching on yogurts, I always found out that some yogurts say Greek style.
Yeah.
So that makes a difference, right?
Definitely. A lot of products will have like high protein, Greek style, and it doesn't actually always mean that it is, it is that. So what you want to look at is for Greek yogurt. You can see it's a natural Greek yogurt, authentic strained, whereas if it's Greek style, I would be questioning that. So potentially, Rowena, it might have been that there was that Greek style, and then when you turned it over, it was full of cream and additives. So it's a great point, Christina, just to be really mindful and look at the ingredients. When we look at this one, it's just skim milk and the live cultures, which is a really great way to support healthy gut.
That's great. Thank you.
No problem.
And if I could just sort of touch on the frozen vegetables.
Yeah.
I know that some people are a little cautious to having frozen because they think that they're not as nutritionally dense as not frozen. Does it make a difference if they're like snap frozen, or it doesn't matter at all?
Doesn't matter at all. They all get cooked eventually, and they're sometimes a lot more affordable. So I'm definitely not against buying frozen veggies if that's more convenient for you and your household. Completely fine. And sometimes when we freeze vegetables, it can actually remain and retain and hold on to that vitamin or minerals from being frozen. So no, it's completely okay.
Perfect. Any other burning questions, ladies?
Yep, Pauline.
Just a question on weight gain.
Yeah.
Have you come across many people that tolerate anti-hormone treatment for several years, and then after 3 or 4 years actually gain a lot of weight, which seems to be unexplained? Have you experienced that?
Yeah, weight gain is a really common thing, and it's what I see with a lot of the women that I work with who are on that treatment. And that's because of the disruption to the hormones. So it's something, like I mentioned, it can be really hard to control. So when we want to try and do things that you can control, right? So it's focusing on that Mediterranean style diet. If you wanted to, you could do intermittent fasting, which is a whole nother topic that if you want to know more about, we can jump on a call for sure and we can chat more about that. But that can, lower the calorie intake, but also support your body. And there's been studies to show that intermittent fasting has worked for women with breast cancer. It's just really good to be mindful about if you were to do intermittent fasting, when it would be the right time to do it. So if you were going through treatment and really struggling with nausea or vomiting or any side effects, it's probably not the best time to do it. But if you were feeling really good, it's something that we could potentially recommend and guide you through on how that works. And it may lead to some weight loss.
So it's not unusual to have
unusual.
that, like even after like 4 or 5 years to have that sudden weight gain.
Yeah, not unusual at all. Everyone's bodies respond really differently, but the weight gain, whenever it is a quite common side effect.
Great.
Anything else we can think of? Otherwise, might start wrapping up. Awesome. All right. Well, Zoe, this has been absolutely fantastic.
Thank you.
So thank you so much.
Thank you so much for having me, and you've all been so nice and wonderful to talk to. Like I said, please get access to our free resources. They're there for you. If you have any difficulty getting access to it, you can email us or call us and we can guide you on how to get that. Any other questions or any other concerns, we offer that free 15-minute call, so reach out. But yeah, I'm just wishing you guys all the best, and I hope that you can take some of that information on board and into practice.
Yeah, I will send you all out an email with some information and on course details if you want to get in contact with them. But yeah, this will be available. The recording will be available as well. We've gone through so much. But thank you again, Zoe. It's been so
no problem.
Thanks everyone for coming.
Thanks, Christina. Have a great day, everyone.
Thank you.
See ya.
Have a good afternoon. Bye, everyone.